Do you have PCOS? Today, let's take a look at symptoms and signs that may indicate that you have PCOS and need an evaluation by your healthcare provider. PCOS is Polycystic Ovarian syndrome. It's an endocrine disorder that often goes missed or overlooked. It's really hard to diagnose because what one provider may feel is normal, another provider may see as abnormal. Very frustrating for you as a patient, I understand. Today, I want to empower you and to look at 4 different signs, or what some may categorize as 4 different types of PCOS, to empower you to take back control of your healthcare and get the proper diagnosis and treatment for PCOS. It takes an average of 2 years and 3 or more providers to get diagnosed with this. And oftentimes it's you, the patient, coming forward, telling your healthcare provider, hey, I think I have PCOS, for them to step back, take a look at your symptoms, run, hopefully, the proper lab work, and get the diagnosis. I've included in today's video a handout that's free for you to print off, take to your healthcare provider, and advocate for getting the right lab work drawn, along with some other lifestyle tips and tricks I give my patients who have the diagnosis of PCOS. The good news is that having PCOS doesn't mean you can't get pregnant or that there isn't a helpful thing out there to help navigate this disease. It is a lifelong disease. It's oftentimes genetic. So if you have a conversation with others in your family, you might find that there's others that have the same symptoms or similar, and they have PCOS as well. Let's begin at looking at the 2 main diagnostic criteria used to diagnose PCOS. These are used by healthcare providers and they have some similarities. So the first one is called Rotterdam criteria. This is 3 factors and you have to have 2 of the 3 to be diagnosed according to the Rotterdam criteria. The first one is excess androgens. What does that mean to you? Androgens are male hormones. It is when our male hormones inside of us as females are a little bit elevated or a lot, and this is causing our female hormones to be decreased and not do the job that they're supposed to do. That includes your menstrual cycle, ovulation, which is the second category in this. You're not ovulating or you have irregular ovulation. Number 3 is you have polycystic ovaries, which are found in an ultrasound. So what does this tell you? If you have 2 of the 3, you don't even need that ultrasound showing you have polycystic ovaries. In my practice, I have found it very hard to actually capture women with ovaries on an ultrasound that are polycystic. So I look at you as a patient. I listen to your symptoms that you're sharing with me, which we'll talk about, and I have listed in another video as well. Androgen excess society is another criteria that providers often use. Once again, they say you have to meet all of the following. It's 2. Number 1, androgen excess symptoms, those male hormone symptoms. You have hair growth on your face. You are not getting your period. There's 2 right there. You have acne that's uncontrolled. There's many signs of androgen excess that we can look at to help determine if your levels of androgen are elevated. Number 2, ovarian dysfunction or polycystic ovaries. So are you ovulating? Once again, do you have a cycle? Do you have many little follicles forming on your ovaries every month, which was shown by an ultrasound? Let's look at what are signs of androgen excess. This, once again, as a reminder, is where you have too much male hormone inside your body and your female hormones simply are not able to do the job. It's thought that 20 to 30% of women with PCOS have androgen excess with their PCOS. We look for acne, unwanted hair growth, face, lip, chin, chest, nipples, belly. You have really coarse, dark arm hair, leg hair, just to name a few. You're losing your hair. Maybe you have lots of hair loss throughout the month. You have male pattern balding. You're balding on your head area. Oily skin. Perhaps you have irregular menstruation. Once again, you have no clue, or maybe all of a sudden your period was normal and now it's not normal and you have no clue when it's going to happen again. Obesity. You've tried everything under the sun to try and lose weight. Or you had a time in your life where you had this sudden onset of weight gain. You change nothing, and it's really hard for you to lose. These are some indicators of androgen excess in your body. So let's take a look. Are there really 4 types of PCOS? Let's break that down. The first one is insulin resistance. Our body's main source of energy is glucose or sugar, which we get from food. After we eat, it enters our bloodstream and the pancreas starts to process it. If you have insulin resistance, your cells don't respond like they should to this. And the signal to insulin to stop is not working as it should. In turn, there's too much sugar in your bloodstream, and signs of this may include irregular periods, excess weight, acne, and hair changes. Number 2, post-pill. I like to have a discussion with my patients that begins something like this. Tell me about your periods in high school, as a teenager, when they first started, and into college. Did you go on birth control? And if you did, was it because they were heavy and painful? Was it because you had no clue when you were going to get it? Was it because you had a 2 to 3 week long period? This is what we need to know before you went on birth control. Then we can look at what happened to your cycle after you came off birth control. We know that if you had PCOS symptoms before starting birth control, it's better for us to take that history and really look at you as a whole picture to determine, could you have PCOS and could the pill have impacted that when you came off of it? And now you have signs off of your birth control that look like PCOS. Keep in mind, your cycles can return to normal after coming off the birth control for 3, 6, 9, 12 months. And then all of a sudden, what's happening? They're not normal. We look at your whole history of your menstrual cycle to kind of help us determine if you have signs of an endocrine disorder going on, like PCOS. Number 3, inflammatory. Is there inflammation going on in your body? This in turn can cause the ovaries to produce too much androgen levels. And the signs of this might look like fatigue, skin issues, once again back to our skin issues, acne, oily skin, food sensitivities, bowel discomfort. Are you bloated, gassy? Foods are irritating your stomach every time or certain times you eat them? Do you have generalized body aches? Do you have joint pain, headaches, migraines? You might have had these or you didn't have them before and now they're happening all the time. These are signs of inflammation going on in your body that need to be looked at further. Number 4, adrenal. This type of PCOS is thought to be caused by elevated cortisol levels, which is our stress hormone that's released from adrenal glands. We know that when cortisol is elevated, it's common to see an elevation of our androgen levels. DHEA. DHEA is the most common one that we see elevated in this case. Signs of this might look like an elevated DHEA level. This can be done by blood work, but also my favorite, Dutch hormone test through your urine, which looks at over 60 different kinds of hormones in your body, including your cortisol levels. Testosterone levels, are these normal or abnormal? Because many times I find women with PCOS can have a normal blood level of this and have signs of elevated testosterone, or the right lab work for testosterone wasn't drawn by their provider. And then let's go back and take a look at our symptoms of inflammation. That can also indicate that you have an adrenal situation going on. It's really vital for you to find a healthcare provider that listens to you and rules out other conditions. So other conditions might be thyroid conditions. What is your prolactin level? And are you deficient in something like vitamin D, zinc, and other nutrients? And let's not forget that women with PCOS might be lean. You might not have any signs of weight gain. You might have a really hard time gaining weight and still have PCOS. If you enjoyed today's video, hit like, hit subscribe, and follow along for new videos every week, and share this with a female in your life who you feel might be struggling with symptoms we talked about today or found in my other videos.